Hey guys, this is Patrick Hall with Fstoppers.com, and today's video, it's a little unlike anything we've ever released, and for me personally, it is the most intimate video I have ever released by a long shot. A lot of you guys that have followed us over the years have probably noticed that our YouTube channel has slowed down significantly, and you're probably wondering what in the world's happened with Patrick, what's happened with Lee. Did Lee give up the site to SLR Lounge? Where's Patrick? We haven't seen him in ages. Are you guys still getting along? You're living together in Puerto Rico. What in the world is going on? There's one video in the last month. And I just wanted to release something so that, one, our fans and people who like our channel and our content would know what's going on. And probably more importantly, I just want to get a lot off my chest and explain some of the stuff I've been dealing with when it comes to Crohn's disease. Now, I've been very open that I've had Crohn's disease. I was diagnosed when I was like 12. I actually came very close to dying when I was 12. I was incredibly underweight. I think I was like 80 pounds in fourth grade. It's fourth grade in 12 years, does that make sense? But you get the point. When I was in fourth grade, I weighed very little, and then I wasn't diagnosed with Crohn's disease until I was in the sixth grade. And luckily, a bunch of great doctors really saved my life. And I went through a lot of treatment, and I came out of high school pretty good. I went through college, I was very healthy, everything was fine. And in 2007, things got very serious very quickly. I wound up having to have a resection right there at my small and large intestine. They cut out several inches of my large intestine, several inches of my small intestine, and then reconnected it back together. And many doctors at the time said, you know, Patrick, you had a major surgery. I have a huge scar. They cut open my whole abdomen. And they said, you know, you probably should consider getting on some medicine and really treating this seriously. And at the time, I don't know if I was stubborn or if I was just scared of many of the medicines that were on the market back in 2007. And, you know, I just kind of said, let me just play the cards that I've been dealt and let me see what happens. I just had surgery. Maybe everything will be okay. And lo and behold, I went 12 years with everything being pretty okay. I don't even know in 12 years that I had any symptoms that would make me feel like I had Crohn's disease. If you don't know what Crohn's disease is, it's basically an autoimmune disorder. There's been a lot of speculation of what causes Crohn's disease, and the truth is most doctors still don't totally know. There are some genes that you can have that will make you be predisposed to getting Crohn's disease. There is a genetic element of it. But there's also a lot of environmental aspects that, you know, it could be diet, it could be stress related, it can be where you are in the world. It's really interesting that many third world or developing countries have very, very small rates of Crohn's disease. And some of the highest rates of Crohn's disease are actually found in Western culture or in Ireland and Scotland and England. And they think maybe it has something to do with the way we pasteurize milk. But either way, we don't exactly know what causes Crohn's disease. But what Crohn's disease is it's basically an autoimmune disorder that causes your body's natural immune system to attack itself. And if you know anybody with Crohn's disease or ulcerative colitis, any kind of irritable bowel syndrome, basically their immune system is attacking their gut. And it's slowly breaking down the cells along the large or small intestine. And it causes ulcers, it causes bleeding, it can cause arthritis. There's a whole host of things, stomach cramping. It's a pretty nasty disease. I do have to say, luckily, I've always felt like my disease has been fairly mild. There are very few dietary restrictions that I've ever had. And as you've seen through our channel, I've been able to travel the world and do absolutely amazing things, and it's never really held me back. But there are some anxieties that come with it, mainly, you know, cramping. Do I have to be near a restroom when I'm out? You know, some of that stuff can really psychologically mess with you. And so if you have Crohn's disease, I know you know what I'm talking about. So that's kind of been my past. 2007 was when I had a major surgery. And then from 2007 till now, I've had 12 great years of absolutely no symptoms. Started Fstoppers in 2010, and we've been kicking ass and making some pretty cool content and having really the best years of our lives. We just moved to Puerto Rico in 2019, and in the back of my mind, I always said, just do not get sick while you live in Puerto Rico because it's going to be a lot harder to get healthcare down there. Well, lo and behold, something happened. And I know exactly when it happened. It was when we were shooting the Puerto Rican shootout with Lee and Pi. I remember filming that and then getting back to the studio and editing. And I remember thinking, there is something wrong with my ass. And for some of you, this may be a little too much information, but I'm just going to lay it all out there. I started to notice something that felt like a blister. It felt like a pimple. It's about the size, I don't know, your pinky. It was like a dime maybe. And it was pretty deep inside the crevice of my butt. And I went and saw a local physician, and I thought maybe it was a hemorrhoid. And I thought, maybe I'll treat this as a hemorrhoid for the next week. Nothing got better. In fact, it started to get worse. And so I had a local physician look at it, and he was like, that's not a hemorrhoid, that's an abscess. And so I immediately knew this was pretty serious. And so I wound up flying back to South Carolina. I went to my gastroenterologist, who I had not seen in 12 years, and basically had a surgeon look at it. And he said, you know what? We need to do a CT scan. We need to see what's going on here. And basically what they found was that I had what they call a complex fistula. Now, if you don't know what a fistula is, it's basically a little passageway that goes from really anywhere, but typically it's your reproductive system or it's your digestive system. It could be your esophagus. It could be anything really. But in my case, it was a passageway that went from my large intestine into just, the muscle of my ass. And it started to get infected, and it caused an abscess. And so typically anybody can get this. You don't have to have Crohn's disease to have a perianal abscess. But when they found out that I had had a history of Crohn's disease, they said, you know what? This is probably a recurrence of your disease. And so I didn't want to believe that. I think I was a little bit in denial, and I didn't want to think that my Crohn's disease was back. And in fact, I felt great. I really have had no stomach cramping. I've had no major problems that I would associate with Crohn's disease. And so it was kind of a shock that this thing is back and it's causing such a painful problem for me. And so they did the CT scan. They said I had this complex fistula and I had a fistulotomy. Now, if you don't know what a fistulotomy is, I would not recommend Googling it. And for sure, do not go on YouTube and start looking at the operations, because they're absolutely horrific. It's the scariest thing you will ever see when it comes to a procedure. Unfortunately, I did a lot of research and saw those videos, and I was scared to death. And basically, they put you under really quick surgery. It's about 20 to 30 minutes. Basically, they clear out the passageway, they allow everything to drain externally, and then you're now in the recovery period. And for a fistula, the recovery period is like 2 to 4 months. And for some people, they never actually recover from it. They constantly have drainage out of this hole, and it causes a lot of severe cramping and pain and anxiety. It's the worst thing I've ever gone through. I was completely opened up for my first surgery, and I feel like the recovery on that was not that bad. You're in the hospital for a few days, but this one, I mean, I'm still recovering from it, and it's 6 weeks, 7 weeks out now. And, everywhere I go, not necessarily today, but weeks ago, I would have a lot of anxiety, and I was just constantly always in pain, and I felt like it's like a constant throbbing that just doesn't go away. And so if any of you out there have had Crohn's disease or have had any kind of surgery, especially fistulotomy, I definitely feel for you. It's not a pleasant experience, and it's one of those things where even after you come out of surgery, you'd like to believe that, I could just sit down and edit videos and I can get back to my daily routine. But the reality is there's so much anxiety of you just wondering, is this getting better? Am I healing? I'm in pain. Am I going to have to use the bathroom? In many cases, the second you use the bathroom, all of the pain comes right back, and you're on narcotics, you're on pain pills, and there's really not a lot that you can do except wait it out. And I have found for me that I was not able to edit. I was definitely not able to film. And it felt like a pretty lonely, scary place to be. Luckily, I'm surrounded by a lot of friends and family, and they've definitely helped me through that. And so I thank everybody that's been on this journey with me. Now, the fistulotomy cured the problem I was having with the abscess, the infection that I had, but it really had nothing to do with the Crohn's disease. I still had to get that tackled. So unfortunately, I had to wait 30 days before I could see my gastroenterologist and schedule what would be a colonoscopy. And I just had that 5 days ago, and they found what I was hoping would not be true. They found a lot of activity. Now, I say a lot of activity. For me, it's a lot of activity, but it was mild to mid-level Crohn's disease. And so it kind of reaffirmed what the doctors and the surgeons were suspecting. And with some other blood studies, they've definitely said that I have, an active case of Crohn's disease. So now I'm faced with the issue of, well, what do you do with this? A lot of people online might say, well, just change your diet. Do an elimination diet, remove everything, maybe eat one item, maybe it's chicken, maybe it's eggs, maybe it's protein shakes, and just slowly add things to your diet until you can figure out exactly what is causing the problem. I'm kind of in the middle of that. I've removed a lot of the items that would cause problems for most Crohn's patients, and a lot of that is carbohydrates, sugars, fibrous vegetables and fruits. Many things that you would think would be very healthy for the average person to eat actually are pretty problematic for many people who struggle with Crohn's disease. I don't know that I've figured out anything through that. I'm only 5 or 6 days into this elimination diet, and so I'm trying to do as much as I can to figure out what's causing it. I feel great at the moment. The last 5 days have been the best days of the entire last 2 months that I've had. By no means am I completely recovered. I feel like I'm getting better like 1% every day, and it's only been about 30, 40 days since I've had the surgery. So as you can imagine, I'm still feeling like I'm about at 50%. So the next step is to figure out which medication I'm going to get on, and there's several medications that you can choose between, one of them being Remicade. The one my doctor recommended is Humira. You've probably seen these commercials on television, and Humira treats many autoimmune disorders. Basically what it does is it suppresses something called TNF. TNF is tumor necrosis factor. It's actually the alpha version. And what TNF is, it's basically a protein that your white blood cells and phagocytes release so that your body can attack anything that's foreign in your body. And this is a great thing because if you have anything wrong in your body, this is part of the normal immune system response. The problem is that I have too much TNF that's being produced. This is the theory at least. And so I need to downregulate that by having something that binds to it and prevents the Crohn's disease outbreak that I'm having. So Remicade is one drug that you can take, and basically that is an infusion, which means every 6 weeks you have to have an IV. You have to sit somewhere for 3 hours, watch a movie, and they basically give it to you in an infusion form. The nice thing about this is, hey, it's every 6 weeks. That allows you to do quite a bit in between treatments. The problem with this is if you ever want to travel, or if you are scared of needles, or if you have to be in a specific place at a specific time, you got to be pretty flexible to make sure that you can plan for that. Humira, on the other hand, is an injectable syringe. You have to take it every 2 weeks, typically. So that means that every 2 weeks I have to give myself an injection. What's nice about this is that I can travel with it. You can keep it refrigerated. I can, potentially do another photograph in the world, or I can, travel anywhere that I need to and be able to give myself injections and hopefully not have to change my lifestyle too much. The downside is I'm giving myself injections every 2 weeks. And then the big problem that I have is many insurance companies only want to give you 2 doses, only 1 month's worth of medicine. So if I ever need to go somewhere for more than 4 weeks, I really have to make sure that I have the medicine to be able to do that. Otherwise, I'm going to be flying back home to get the medicine. So hopefully I can figure out that problem. The big problem with all of this is that these medicines, they're immunosuppressants. So basically they are going to reduce my immune system so that it doesn't attack myself. But the consequence of that is that I'm going to be more susceptible for infections, especially upper sinus infections. It makes you more susceptible to certain cancers, even though it's a tiny, tiny, tiny percentage. I don't really think it's anything to worry about, but it is something that is written all over the drugs that you have to be prepared for, that you are at a higher risk for certain cancers, certain heart conditions, heart failure. Very scary stuff. But, at this point in my life, I don't know really what else to do. The diet thing, there's really just no clear evidence that diet can make a difference. And if it does, it's a very, very long process. You do these elimination diets and you have to figure out exactly what is wrong for you personally, because every single person is different. Some of the other medications, they do basically the same thing, but these medicines, especially Humira, is apparently supposed to put me into remission pretty quickly. So if any of you have been on these drugs, I'd love to hear what you have to say. I know some of the injections are very painful. There's a couple new, there's one new formula that does not have the citrate, which apparently makes the injection a lot easier to take. Right now, I just got off the phone with my insurance and with some of the ambassadors for Humira. I was on the phone for 2 hours today, 2 hours. And I think I'm in luck. I think my insurance is going to cover all of this treatment, and I believe that I can pick up the drugs in any state that I'm in, and also in Puerto Rico. So that's really exciting. They will ship the drug to me, which was one of the biggest hurdles that I was worried about with Humira. So I'm going to probably make another video to update you guys on how the process is going, especially those of you who have Crohn's disease. This video is really for you guys. Like, I want to release a video and kind of walk you through my process. I know I've watched many videos on YouTube to try to ease my mind and to figure out if this is the treatment that I want to go down, the treatment path that I want to take. And so I'm going to keep you guys updated. I'm going to be transparent about this, and I think this is a fun little, it's not really fun, but it's something else that I can release that hopefully some of you guys will find interesting. And very soon I'm going to be back in Puerto Rico helping Lee out. We're going to kick butt and start making more videos just like we've been doing. We've been on a roll. If you haven't noticed, this Puerto Rican move, we've been releasing a ton of videos. So I want to get back to doing that. I want to get back on my feet and start doing the things that I love. Hey, how's it going?
Why do you look different? What are you doing?
What am I doing? I'm making my confession video. I'm doing my Crohn's disease video.
Is that why you shaved and stuff?
Yeah, I'm doing it very intimately. Like you can see, it's right on my face.
Oh, you look really good.
I do look really good. Like, I look pretty good. I'm happy with it. So, you have any words to say for them?
No, I don't want to be in this.
You don't want to be in this video? Okay, well, you better hang up. If you're my girlfriend, you call me while I'm filming, you make the video. That's how it goes. All right, she hung up on me. So I know this video is long. I know this is like me telling everything I've experienced in my life related to this disease. And for many of you, you probably don't care at all. But for those of you who might have Crohn's disease or have friends and family who struggle with this disease, I'd love to hear back from you. I'd like to know what you have done, how your treatment has gone, what the first couple weeks being on Humira was like, what the first starter kit was like. I don't know when I'm going to start that. Hopefully in the next week. It's like 2, 3, 4 shots to the stomach. That one's going to be really fun. And then it'll be 1 shot every 2 weeks. So it seems very manageable. But I'd love to hear from you guys. Reach out to me. I'm definitely reading everything I can about this, and I'm trying to, be positive and get back to what I love doing, making videos and doing photography and traveling and kind of, sharing my life through a camera. So we have some really cool things coming down the pipeline for you guys, so stay tuned for that. Subscribe to our channel if you're into photography and videography. And I have to say thanks to everybody out there who's been supportive. I know many of you guys, this is new information to you. You had no idea that I struggle with Crohn's disease. And I just want to remind everybody, if you're healthy and you're living life to your fullest, don't take it for granted. Enjoy everything that you're doing. So if you ever get to travel, if you get to chase your passions, if you get to be surrounded by your friends and family and loved ones, don't take it for granted, because sometimes, life comes and kicks you in the ass, and, it's tough. It's tough. It's not an easy path to walk, but, we've all been there, and if you haven't been there yet, at some point you will. So if you want to give out and help people like me who have Crohn's disease, I have a link down in the description below for the Crohn's and Colitis Foundation. That is the absolute best way that you can donate money to help try to figure out what is causing this horrible disease. Hopefully we can come up with either a way to cure it or, at least treat it with less invasive drugs. Crohn's and Colitis Foundation, they've been great to me over the years, and it's the one foundation that I'm 100% behind because I actually struggle with this disease. If you'd like to support me or the Fstoppers team, check out fstoppers.com/store, where we have a ton of photography and video related tutorials. I'm not asking you to buy anything, but if you do, a portion of that money does go to me to help me through all of this. Luckily, it sounds like insurance is going to pick up most of this, which is a huge blessing, But, I'm going to keep you guys updated, and hopefully soon you'll see me out there kicking butt and taking names. And I need to get into some of these photo contests because Lee has been losing all of our photo challenges and making Fstoppers look really weak. I need to get out there and start winning some of these. So I'm on a 3-win streak. If you don't know what I'm talking about, check out our channel. We have some really cool competition videos. But in the meantime, I'm going to leave you with that. Thank you guys for watching. All my friends in Puerto Rico, hopefully I'll be seeing you soon. All of my old friends in Charleston, South Carolina, hopefully I'll start feeling better and can hang out with you as well. So hopefully you'll see my face a lot more often now that I'm getting a lot healthier, and I'm going to start this drug. But for now, I'm going to go hit the sack, get some sleep, and I will see you guys later. So take care.